Thank you. And I want to say that I'm delighted I was asked by a patient to present at this conference, and so I'm really pleased to be here and sharing some time with you today. Next slide. The objectives today, I want to be fairly practical and give you some tools that you can use to help you cope with your condition and your breathing problems. The first thing I want to do is go through some techniques that help with breathing control, and then do some breathing exercises with you if you would like to join in. They're very light exercises. They're how we start our day 5 days a week at West Park Healthcare Center with the respiratory patients. So they're not more strenuous than getting dressed, so they're fairly safe. But if you have any concerns and don't want to do them, those of you who want to can join in. If you don't want to, then don't feel obligated. I want you to have an understanding of what happens when you stop doing things because you have shortness of breath, because that's a very common scenario. People stop doing things because they get short of breath doing that, and that has definite consequences. And give you an understanding of what exercise can do for you. Exercise is important for everyone. It has a lot of benefits, probably more benefits than any single thing that you could do in terms of your overall health. Next slide. So before we go any further, I just want to get an idea of how many of you who do avoid climbing stairs because of your shortness of breath. Can you just show me your hands? So there's several. When I first meet with patients, that's one of the things that they often tell me they really try to avoid if they possibly can. And another question, how many of you actually like to do exercise? Oh, so quite a few. Good for you. Okay, because a lot of people don't like doing exercise. So maybe my job isn't quite as tough as I thought it might be. Okay. So we're going to be basically going through a couple of breathing techniques. Pursed lip breathing and diaphragmatic breathing, and as I'll explain why we do those, but these are techniques that help you control your breathing. It's common for patients with breathing problems to not be breathing properly or not using the techniques that would help them. And the third thing I'm going to go through is SOS for SOB. And when my husband saw me preparing this presentation, he said, "What are you doing?" And of course, he saw SOB. But at West Park, that means shortness of breath. So pursed lip breathing. Go to the next slide. What happens when you have COPD or emphysema is you trap air in your lungs. You have difficulty getting the air out of your lungs. So it's like you've got a balloon that's overinflated. The reason you trap the air in your lungs, Dr. Binney talked about some of the anatomical changes where the alveoli or the little air sacs get larger. The lung tissue gets floppy. So what happens as you're breathing out, the airways collapse before you can get all the air out that you should be getting out. And that's why your lungs do get overinflated. The reason why we promote doing pursed lip breathing is what we're trying to do is splint the airways a little bit so you can get a little bit more air out. We frequently do see people come to us too who've just learned that this works. So I'll demonstrate it to you. It's quite simple. It's just breathing. You're breathing in through your nose, and then you purse your lips, and you breathe out slowly. So just letting the air go out at a natural rate. So I sometimes see people do. So of course this is magnifying the sound, but you shouldn't hear somebody breathing out as they're breathing out. If you force it out and make a sound like that, if you have any asthmatic component to your condition, you're likely to cause the airways to close even more quickly. So it's important that that breathing out is gentle, not forced. You also want to be working on trying to breathe out twice as long as you breathe in if you can. Again, the length of time is to try to get more air out of the lungs. And if this is not a natural way for you to breathe, then I can assure you, if you keep practicing it, it's not any different than a golf swing or how you throw a curling rock or any other type of motor skill. If you practice it, it eventually becomes very natural to you and you won't have to think about it. That's the way you will breathe. I have a colleague. I know she's stressed when I see her coming in the morning and she's doing her pursed lip breathing. And I often find myself doing pursed lip breathing when I'm not teaching patients because it's become a habit, and when I exercise, I do pursed lip breathing sometimes. So pursed lip breathing is one technique. We'll be practicing this as we do the breathing exercises. On to next slide, we'll go through diaphragmatic breathing. So before we do diaphragmatic breathing, the diaphragm is a muscle. It's shown here sitting up under the rib cage. It's a big muscle. When your lungs get overinflated, it pushes that muscle down, it flattens it out, so it makes it shorter. When you arm wrestle, how do you arm wrestle? Do you arm wrestle out here? You arm wrestle here, right? That's because that's where your muscle's the strongest. If you're out here or you're here, your muscle is not very strong, so you won't be effective. You're going to lose the arm wrestle. Because your diaphragm is pushed down by the volume of your lungs, it doesn't work as effective. It's like your biceps. If you're arm wrestling, it's the way the muscle works is the same. So it's not as strong in the position that it's in when your lungs are overinflated. The degree of overinflation varies from one person to another. So some people, it's pushed down a little bit. Some people, it's pushed down so much that it's actually, instead of being concave, it's convex a little bit. So you can imagine that's a big difference from where the diaphragm is in that picture. So that's what's happening to your diaphragm. The reason we want you to do diaphragmatic breathing, there's a lot of blood vessels down in the lower part of your lungs. Blood vessels are important. They're what carries the gas, the carbon dioxide and the oxygen. So you're carrying the carbon dioxide to get rid of it, the oxygen to go to everything in your body. All your tissues in your body need oxygen. So we want you to try to be able to use the lower part of your lungs so that you can get more oxygen into your blood and get rid of more carbon dioxide. On to next slide. So what we do, maybe I'll just grab a chair. In breathing class, we practice diaphragmatic breathing every day. A lot of people breathe with the upper part of their lung here. So when we watch our patients breathe, we can tell what part of their lungs they're using. So if you put your hand here on your abdomen, you need to relax your abdominal muscles. Relax your tummy muscles. Try to take the air in through your nose. Let your abdominal muscles relax, and you should feel your abdomen come out as you breathe in and go back in as you breathe out. That's diaphragmatic breathing. Just in through your nose and out gently through pursed lips. If you look at any baby, I guarantee you'll see their tummy go out as they breathe in and go back in as they breathe out. That's how we all breathe when we're born. What happens is we're vain, and we pull in our stomachs, and we stop breathing with our diaphragm. So it's much more common also in women to stop breathing with their diaphragm than men. Having said that, when your lungs are overinflated, some people, I truly believe, cannot, if their lungs are so overinflated, they can't breathe with their diaphragm. Just because the muscle's so stretched or in such a bad position for working that they can't use it for breathing. The easiest way is not sitting in a chair or standing. The easiest way to breathe with your diaphragm, so if you can't do this, you could go home today, try lying down in your bed, raising your head to whatever height you need to breathe comfortably. Bend your legs up so your feet are flat in the bed. You can put something like a box of Kleenex or a light book on your stomach. See if you can breathe with your diaphragm in that position, because that will be the easiest position for you to breathe with your diaphragm. I've had patients who I've tried to teach it to sitting up, and they couldn't do it, and lie them down like that, they do it right away. So that's the easiest position, so you could try that. So that's diaphragmatic breathing. On to the next slide. SOS for SOB. Can you hear me with this mic? When people have shortness of breath, it's an uncomfortable feeling. So what tends to happen is it creates a lot of anxiety. People start to feel panicky, which makes them more short of breath. And often it's the reason why they will go to emerge is they're basically in one of these uncontrolled breathing patterns where they're anxious, they're getting more and more shortness of breath, and they just can't control the situation. It's not uncommon that it does cause trips to the emergency department. And we frequently, our patients, I would say not all our patients, because some of the patients who are higher level, not as seriously involved with their lungs, they can control their breathing, but this is very common. We see a lot of people with this type of thing. So we teach them SOS for SOB. So when you start to feel that you're losing control of your breathing, you need to get into a position to rest in. So if you are near a chair, or if you happen to use a rollator to walk on, you can sit down and get back in the chair. Try to keep your shoulders down. A lot of people with breathing, they're getting their shoulders hiked up like this, and then they start to use accessory muscles of breathing, which aren't all that really effective for breathing. So try to relax your shoulders down. Keep your head up. You don't want to go too far down because you'll cut off your airway. You don't want to go too far up, but head forward just a little bit, and you're going to breathe in and out through your mouth. Like a dog. So, you know, when you see your dog and your dog's been running, they pant in and out through their mouth. So you're going to pant in and out through your mouth as fast as you need to until you start to feel better. Eventually, you should start to feel, after you're breathing in and out through your mouth as quickly as you need to, then try to slow it down and try to breathe out a little longer through your mouth. So it's and then eventually you're going back to in through your mouth, or in through your nose rather, and out through pursed lips. The reason you're going through the breathing with your mouth, there's less work to breathing through your mouth than breathing through your nose. So if I breathe through my nose, I'm doing more work than if I breathe in through my mouth. It's a more direct route. So why do we teach people to breathe generally through their nose? A couple of reasons. There's hair, and there's little fine hairs, and there's mucus in your nose that collect dirt. They clean the air for you. And there's also blood vessels that warm the air. So that's why, generally speaking, we want you breathing in through your nose, breathing out through pursed lips. But when you're really short of breath, breathe in and out through your mouth. It's easier, and you'll be able to get the control. I do fairly high intensity exercise. When I'm exercising high intensity, I'm not breathing in through my nose, I'm breathing in through my mouth. Once you gain control of your breathing, you need to stay in that position for at least 5 minutes. So if it takes you 5 minutes to gain control, then you need another 5 minutes to make sure that if you get up right away, chances are you'll lose control right away again. So stay in the position for 5 minutes. Next slide will show you a couple of positions. So some people have told me they like to prefer to stay in standing when they go through this, that they are more uncomfortable when they sit down. Some people like to lean over the kitchen countertop, or if you're out and there's no chairs and no buildings to lean against, you can use a tree, anything like that. And just, you basically prop yourself up against it with your feet out a little ways from it and go through the same steps. So that's SOS for SOB. Next slide. Breathing exercises. So breathing exercises have several purposes. First purpose that we do them for is for you to practice breathing control. So I had a patient within the last few months who had a bit of an unusual breathing pattern. Her normally breathing is you breathe in once and you breathe out once. Her breathing pattern was something like this, and it was breathe in and then. So she was taking 3 or 4 little breaths out before she'd breathe in again. So actually, this is one of my colleagues saw her, and when I was away one day, and she taught her how to use a Kleenex to practice her breathing control, and I thought it was a great idea, so I thought I'd show it to you today. So you take a breath in. The Kleenex moves towards you a little bit as you breathe in, and then breathe out. And breathe in and out. Breathe in and out. So it's just a very simple exercise for someone who was not controlling their breathing particularly well. Her breathing pattern was quite ineffective, and with practicing that, and she had to go back and practice it several times, but eventually she got that she was doing one breath in, one breath out. So to practice effective breathing patterns, we do breathing exercises. They're quite effective just for general relaxation. They're good to maintain and improve flexibility, and they're helpful with removing secretions. So if some of you have secretions, probably the most common time to be coughing up secretions is in the morning. Some people have difficulty clearing them. Breathing exercises, you're taking a little more air in your lungs, you start to move stuff around a little bit, and then it comes up. So that's the purpose of doing the breathing exercises. And so now what I'll do is I'll go through a few. We'll do each one a couple of times. Feel free to join in with me. And I'm going to be demonstrating basically 2 different types of breathing pattern. One we call continuous pursed lip breathing. So that's for an activity that's fairly fast, like arm swinging. We use continuous pursed lip breathing. The majority of the exercises, we coordinate our breathing. For COPD, we're sitting still as we breathe in, and we're moving as we breathe out. So I'm just going to move over to the chair because some of them are done in the chair. So the first one is diaphragmatic breathing, so I'll do it once more with you. Taking the air down to the base of your lungs. Let your stomach muscles relax in through your nose. Trying to breathe out twice as long as you breathe in. When you do this, some of our patients say they get lightheaded. You don't take as deep a breath as you possibly can when you do this. You take a breath in and you breathe out, but not as deep as you possibly can. If you do that, then chances are, yes, you're probably going to get lightheaded. As you're breathing out, you're getting rid of carbon dioxide, and it affects control for breathing. So when you do this, don't take as deep a breath as you possibly can, or else you won't be able to do 10. You'll get lightheaded probably. Trunk rotation. So with this exercise, we can do it this way. Some people like to do it this way. You're going to just bring your backs away from the chair a little bit. Trunk rotation is one that you should do when sitting as opposed to standing. You're going to take a breath in, sitting still. As you move, you're breathing out through pursed lips. Pause to breathe in. Breathing out through pursed lips. Breath in and out. And breath in and out. And relax. And next slide. The next one's elbows back. I like this exercise because it's working the muscles between your shoulder blades, and people often tend to get round-shouldered and don't use the back extensors very much. So you're working these muscles that are back extensors. They're good for your spine, and they also help to keep you from getting round-shouldered. So you start with your arms a little below shoulder level. So say if this is shoulder level, you're just going to drop your arms down a little bit. Take a breath in through your nose. As you breathe out, you bring your elbows back, pinching your shoulder blades together, feeling your muscles work between your shoulder blades. Pause to breathe in. Breathing out as you move your arms back into the start position. and breath in and out. And breath in and out. And relax. Next one's reaching up to the ceiling. You're going to take a breath in. As you breathe out, you're going to lift your arm up. It's important to, I see a lot of people sometimes stop out here, particularly older people. It's important to go up as high as you can. The last few degrees you're extending your spine. So it's important to go up as high as you can. Breath in and out and lowering slowly. Don't let gravity do the work here. Control your arm going down. You can let it just drop, but then you're not using your muscles. Breath in and out. And breath in and out. Breath in and out. And breath in and out. And relax. Next slide. Windmill. This one takes lots of space. So if you're doing it beside someone who is sitting beside you, perhaps every other person can stand. So. Nobody wants to stand? Okay, breath in. As you breathe out, you're moving your arms up. And breath in and out. So we're practicing our pursed lip breathing as we do this. Breath in and out. And breath in and out. And relax. And thigh strengthening. Quadriceps. I definitely need a chair for this one. I can't do this one standing up. Your quads are big muscles in the top of your thigh. It's really 4 muscles. They're very important for walking, going up and down stairs. They're probably the most studied muscle in the body. And we know that muscle changes not just from lack of activity. There's also changes in muscle related to COPD. There's more fatty infiltration in the muscle. The quality of the muscle is different than in healthy people. There isn't a lot that's known about it beyond that, but it is being studied and they're finding what the changes are. So your quadriceps is very important. You need it for getting up and down out of a chair, and you need it for going up and down stairs and for walking. So breath in. As you breathe out, you're going to straighten your knee and think you've got a ton on your leg, so really work your muscle hard. And hold it at there as you breathe in. As you breathe out, you're going to bend. And alternating legs. Breath in and out. And breath in and out. Breath in and out. And breath in and out. So that's quadriceps. Next slide. Shoulder shrug. I always tell people I think the most important part of this exercise is you focus on the relaxation, because most of you are really good at keeping your shoulders up here, but you're not so good at getting them down here. So focus on the relaxation part most when you do this one. So breath in. As you breathe out, you're going to lift up your shoulders. And breath in and out and relax down. And maybe I'll stand just so people can see me at the back. Breath in. Lifting as you breathe out. And breath in. relaxing down as you breathe out. So that's shoulder shrug. Shoulder circles. So you start with your hands on top of your shoulders. You take a breath in. As you breathe out, you're going to make a circle with your elbows. Breath out, breath in, and out. And now we'll switch direction. Breath in, and out. And breath in, and out. And relax. And next slide. Foot treadling. Okay. So basically we're just pulling our toes up and then pushing them down. And for this one we use continuous pursed lip breathing. So just continuously breathing in through your nose, out through pursed lips. Don't try to coordinate it with the movement. It's too difficult. And this is a good exercise to get the blood moving in your legs. It's good to do if you're on an airplane. Get the circulation going. And usually we do this for anywhere from 30 seconds to a minute. After a minute, if you're working hard, your legs, you're going to feel it in your legs. And then finishing off with some diaphragmatic breathing again. In through your nose. And out through pursed lips. And in through your nose. And out through pursed lips. So that's a sampling of breathing exercises. Now, we encourage our patients to exercise. It's a large component of the program at West Park Healthcare Center, exercise and education. So, you want me to talk about the DVD? Okay. We do have a breathing exercise DVD. I've given a copy to Eileen, and everybody gets one when they go to West Park. The breathing exercises, we encourage people to continue doing the breathing exercises even when they're sick. Now, we do discourage people from continuing with the more strenuous exercise if they are sick and they have a fever and they feel really yucky, then we ask them not to try to do the strenuous exercise. Of course, if you are going into an exercise program, you should ask your physician if it's okay to exercise. Make sure that you're medically stable. Basically, most people can do. I can tell you, everybody that goes into West Park does at least the breathing exercises. They can all, even when they're sick, they do the breathing exercises. And if they're considered contagious and we isolate them, we get them to do their breathing exercises in their room rather than do it in the class. So, the deconditioning spiral. This is what happens when you stop doing something because of shortness of breath. And one of the first things often that goes is stairs. You get short of breath, so you avoid doing stairs. What happens when you do that is your muscles get weaker, they decondition, they don't use oxygen as efficiently, which makes you short of breath. Doing even less strenuous things than stairs, such as just walking at a certain speed, maybe. So then you slow down your walking. And then that makes you short of breath. Then it starts to get difficult getting dressed and undressed because of shortness of breath. It's not uncommon for us to see people who are so short of breath that they're basically housebound. That's not a very nice situation. We can't do anything about your lung damage. Nothing at all to change your lung damage. Once they're damaged, they're damaged. but we can work on your muscles, and that's basically how we're effective is, actually, you work on your muscles. We just tell you what you need to do, and that's exercise. So by working on your muscles, then you get less short of breath. You go in the reverse direction on this spiral, and it gets that you can do things. Next slide. Tackling stairs. So since stairs is one of the most difficult things for people with breathing problems. In fact, we have an exercise physiologist. His name is Tom. And Tom tells me he figures a lot of people go up and down stairs on their hands and knees. And I have had at least one patient who told me that's how they got up and down stairs because of shortness of breath. Yeah. So how do you handle stairs with shortness of breath? Well, you coordinate it with your breathing. So I'll go over here where the little stage is and I'll show you. So you're going to take a breath in. As you breathe out, you're going to go up a step. Or if you don't have too much shortness of breath, you might be able to do 2 or 3 or even 4 stairs. And then you take a breath in and out. And when you're going down, the same thing. Breath in, out, and down. Some of the patients are so short of breath that even doing one stair is difficult for them. So they take a breath in. As they breathe out, they go up a step. And then I say, take a recovery breath in between. Breath in and out and go up the next step. So by doing that, a lot of people notice a difference right away. By the time they get up to the top of the stairs, they're not panting. And they don't have to stop and sit down. Some people stop and sit down when they get to the top of the stairs because they control their breathing as they go. The breathing exercise DVD was funded by a former patient who said, learning to do stairs that way was worth going to the whole program. And he was a frequent flyer. He went to Florida a couple times a month. And so he was doing a lot of stairs. And to him, that was, I think, the most beneficial part of the whole program was just learning how to tackle stairs. Next slide. Now, if I told you there's a magic pill, would you take it? I see nods. Eileen knows what the magic pill is, I think. It's tough to swallow, particularly for some people. The majority of the population, it's tough to swallow. Next slide. This is a bit of a hint. Do you know what the magic pill is? It's exercise. Yeah. Exercise is so good for so many different things, for maintaining health, for preventing different types of medical problems, and I'll show you a list in a while. But it's very difficult. It's a difficult sell. People are busy. They don't have time. They have children. That makes it difficult. They have work. All the other things that you have in your day. I've been pretty much, through most of my life, quite an avid exerciser. In fact, I was such an avid exerciser when I was young, my mother used to say, I'm going to send your bed to the school. And I said, oh, don't worry, just leave my supper in the fridge. I'll get it when I get home. And I'm going to tell you a story about a friend at the gym who, she's 82 years old. And Sally exercises. She goes to the gym 4 days a week, but she either bowls or lawn bowls another day of the week, and that depends on what the season is. So she's exercising 5 days a week. And so I'm waiting at 5:30 in the morning to go into the gym. And I said, Sally, it's going to be a quick workout today. I'm busy at work, so I'm just going to do 30 minutes of aerobics, and that's it. She said, Lynda, why would you bother coming to the gym to do that little bit of exercise? So Sally, she does 20 minutes on the treadmill, walking. She does 20 minutes on an elliptical, and she does 20 minutes on a recumbent cycle. And then she spends about another hour on weight machines. So she's a little dynamo. She also has quite a bit of arthritis in one hip, and sometimes she's limping, but she goes anyways, and she does her exercise. So I thought that was pretty cute. So age isn't a barrier to exercise. Next slide. So this shows a few different types of exercise. So cardiovascular exercise is important for your heart and your lungs. Your heart is, I don't think it's debatable, it's the most important muscle in your body. Because if it isn't working, you're in big trouble. You're not here anymore. So you want to be doing cardiovascular exercise. The Canadian Society of Exercise Physiologists recommends 30 minutes a day, 5 days a week. For some people with breathing problems, they can't go continuously for 30 minutes. So what do you do in that case? Well, if you can do at least 10-minute intervals, then 3 10-minute intervals works quite nicely. Or 2 15-minute intervals. Once you get lower than 10 minutes, it's not so helpful for your heart. So try to get up to that 10 minutes if you can, at least 10 minutes, and do 3 10-minute sessions once a day. See somebody doing some balance exercises. There, it looks like it's early morning. Nice setting. Balance is important. Particularly as we age, our balance isn't as good. I know my balance is not what it was when I was a kid. Or when I was 20, for that matter. Or 30. When our balance gets bad, we have falls. People with COPD, it's an inflammatory condition. Inflammatory conditions, there's more prevalence of osteoporosis. People with COPD, we know, are less active than healthy individuals of the same gender and age. Less activity means not as much bone mass. So you also often take medications that affect bone health, such as prednisone. Makes your bones brittle, less strong, affects bone density. So I say you have a triple whammy for osteoporosis: decreased activity, inflammatory condition, and your medications. So balance is important to try to maintain. Weight-bearing exercises are good for your bones, so walking. It's not only cardiovascular, but it's good for your bone health. And there's somebody doing some stretching exercises there. Flexibility is important. You know that once you start to stiffen up with age. It gets more difficult to do things such as tie your shoes. So that shows some different types of exercise. Next slide. So there we have some more flexibility exercise. Our stair climbing. Doing stairs is also good for the bones around your hips. When we work hard with a muscle, the muscles attach to the bones. They pull on the bone, they stimulate the bone, and they make it stronger. So because going up and down stairs is pretty hard work, it's working those muscles pretty hard and it's stimulating the bone. So it's good it's good cardiovascular, it's good to maintain your strength, and it is good for your bone health in that area. Another thing that we've got weightlifting here. People, when you are muscular, you burn calories faster. So if you want to lose weight, it helps to add some weightlifting to your exercise program. And next slide. Walking. Walking is a great exercise. It's so important for function. People of all ages, pretty much, can walk. And we can do it together with our families, so it can be kind of a nice social thing to do. They're walking on the grass there, which is good for balance. As you age, it gets more difficult to walk on soft surfaces. It's going to be more difficult to walk on grass than it is a hard surface. So it's good for balance. One thing that's really important when you exercise, if you do have a breathing problem, COPD, I'll go back to talking about your lungs being overinflated, because this is one of the things that happens in it when you're exercising. I want to explain what happens to you. So you start exercising. If you're maintaining a steady pace of exercise, the initial probably 3 or 4 or 5 minutes is the toughest usually, and that's because you're bringing your breathing up, starting to breathe faster, and your heart rate is going up. And then ideally what should happen is it should feel easier once you've got through that period until your heart rate and your breathing level's off. The other additional thing that happens with COPD, where your lungs are overinflated, is because you are breathing faster, you have less time to breathe out, so you start to trap even more air in your lungs. We call that dynamic hyperinflation. So then once that starts to happen, you're going to be stopping pretty fast. You're not going to be going much longer before you're going to have to stop, because your lungs just keep getting more and more overinflated, and there's a point where you can't go anymore. So pacing is so important with breathing problems. It's important and some of this, it takes practice. It takes kind of trial and error. But we are all the time saying to our patients, slow down, don't go so fast. I have people who come in and they say, oh, I can only walk like 50 yards, that's it. And it's funny, I get them to walk and they'll walk for probably sometimes 300 yards. I said, I thought you could only walk 50 yards. They said, oh, I don't know why. But if you start off too fast, you're going to have this dynamic hyperinflation happening, and then you have to stop because you're panting for breath. So it's very important to work on pacing, to find a pace that's right for you. And generally speaking, what is recommended for cardiovascular exercise is that you need at least a moderate intensity. So if you're going for a walk and you think, oh, this is no effort at all, you're not working hard enough. You need at least a moderate effort. So when I have patients who don't have any cardiac problems or any other medical problems, then I'll say, well, you can work at a somewhat heavy to a heavy effort. But people with cardiac problems, I'll say, well, keep it at a moderate intensity. So it depends on the patient how hard I will suggest they exercise. And part of it is getting to know your patients. Some people, they're not going to work at a heavy effort, even if they could. They're just not going to do it. It's kind of uncomfortable. And that's true for healthy people too, to do a heavy effort. So what I'm trying to promote is that if you can't do anything else in terms of exercise, walking, just walk. You'll improve your health by so much if you can walk 30 minutes a day. There's been talk about diet, weight control, and exercise. A lot of people think, oh, I'm exercising, so I can eat more. Well, that's fine if you need to gain weight, but if you need to lose weight, unfortunately, usually if you're exercising, say if you exercise an hour a day, it's still only 1/24 of the whole day. So it's only a tiny, tiny little piece of the whole pie. So if you're exercising and you need to lose weight, you also need to watch what you eat. It's very important. So I think sometimes people, when they exercise, think, oh, great, I exercised. I can have a chocolate bar or a bag of chips or both, or a bottle of pop. They're all empty calories. And I can assure you that for most people who exercise for a half an hour, they're not going to be burning as many calories as in a chocolate bar or a bag of chips. So you need to put the two together. There was some talk about BMI and healthy BMI, and I just want to add a little bit of information to that, because for people with COPD, a BMI below 21 is not a good thing. It affects mortality. So I'd rather see somebody with a little bit of higher BMI as opposed to when we see patients and their BMI is 17 or 16, and then they're really malnourished, and it's not very positive. It's usually bad. So actually I would say the recommended BMI for somebody with COPD would be above 21 and to 25. But I'd still rather see somebody between 25 and 30 who exercises rather than to have somebody who is below 21. Okay. Next slide. Benefits of exercise. Decreases shortness of breath. Probably the most important benefit to you. It decreases your shortness of breath. Helps to improve the function of your lungs. Gives you stronger muscles. Increases and or maintains flexibility. Improves bone strength. Enhances coordination and balance. Facilitates digestion. Helps with weight control. Muscles, including the respiratory muscles, work more efficiently. Decreases the risk of some types of cancers. Next slide. Gives you a feeling good. Makes you feel good. Increases confidence. Effective for memory and cognitive function. Improves self-image. Helps to reduce cravings for eating, smoking. Better relaxation and sleep quality. Less anxiety. Reduces depression. And it decreases the risk of frailty. And that's just the ones that, as I sat for a few minutes, came out of my head. And they're all researched, and there's evidence for all those things. I a flutter is a device that's used for secretion clearance. So what I'll do is if you have trouble clearing secretions and you want to see how a flutter is used, I will demonstrate that to you back at the back of the room. Here are some resources. The Lung Association is always a great resource. So we've got Canadian, American, and Ontario Lung Association. The website on the bottom it's a 10-minute clip, and it's talking about the benefits of exercise. It's actually one of my colleagues who works in research got this from her doctor, and it's a really quite a good. It moves very fast, but he talks about getting the best bang for your buck and claims that it is exercise. And next slide, credits. Bill Burke is an employee at West Park Health Care Center. He's an electrician, but he's also an artist, and so all those little characters, we call them Huff and Puff, were drawn by Bill. West Park Health Care Center Respiratory Rehab Team, and back at the back I've got a list of all the different people on our team and our patients who teach us so much. And if there's any questions, I'd be glad to try to answer them. Yes?
How long is the waiting list to get into West Park?
I can't tell you. I'm sure that varies. It's not a wait for beds usually. It's usually a wait to see the doctor. But if you stop by, I'll give you a card, and our care coordinator, I think, will be able to tell you what the wait is to see a doctor.